Welcome to Equilibrium Natural Health. Thank you for joining us in your healing journey. We are so honored you are choosing Equilibrium Natural Health, as we know that there are many options available to you. This video is to help you get the most out of your new patient visit and to help you understand why we do things the way we do. Most people come to us in time of need or crisis, when they have symptoms which are causing pain or dysfunction. Many of them are afraid of traditional medicine or dislike what it has to offer and are looking for alternatives. Some people are just looking to improve their health and longevity. If this sounds like you, you've come to the right place. Here at Equilibrium, our goal is to find the root cause of your pains, fears, or desires and help you achieve your health goals. Now, if you've watched any of our other videos, this may feel like repetition, but it's very, very important for you to understand. Because at Equilibrium Natural Health, we see you as much more than the patient we treat. We recognize you as the most influential person in your health. We partner with you to empower you with the knowledge you need to make educated health decisions. We are passionate about patient education because if we can provide you with the basic understanding of the why and the how behind your health, then you will be more prepared to effectively implement healthy habits into your life. Today's visit is focused on the exam to help you focus on why you are here and get us the answers for what directions we are going so we can get there the most efficiently. It is important to know that there are a couple of main questions that we ask to understand how to proceed in your care of your health. Is your situation acute or is your situation chronic? So allow me to elaborate. If your situation is acute, it usually means that you're in the middle of an ailment which started recently, like a headache from your blood pressure being too high, from the stress you've been encountering in the last few months. In this acute case, we would need a Band-Aid, like a hypertension medication or some supplements to bring down your high blood pressure so you don't die while we're working together, so that we can find the root cause of why you arrived to your acute level of health in the first place. Many people struggle with Western medicine because they forget or are unaware they're asking the wrong questions at the wrong place. The analogy we like to use is going to the hardware store looking for organic health food and maybe even a specialty food item. My guess is you would probably get really frustrated at the person over the counter as you're asking for those things. Traditional Western medicine is focused on the acute situations, and they ask the question, how do we relieve extreme pain or keep a person from death? The main options for care in the Western medicine model include drugs for symptom reduction and or cutting or killing the problem or the area or the system through surgery. It is important to understand that Western medical care is important and definitely life-saving in many situations, like the high blood pressure example. But it tends to be overused and it tends to overwhelm the systems of the body, often causing more problems than good in the long term, which usually lead to more medications in the long term. Natural medicine, on the other hand, provides solutions that support traditional therapies and in some instances replace them, even in some acute situations. So using both natural and Western medicine together will provide you with the best well-rounded care. Here at Equilibrium Natural Health, we focus on what works, simply put. And it's what we're good at. We provide customized plans to support each individual. You can rest assured that you will be provided with the best acute therapies if they're essential to your health, and that you will receive the best treatment for your chronic issues so that together we can find the root cause of your body's imbalance. The next section will review if you've watched some of the other videos, but it's also, again, very important to have the repetition to learn these items so that you can become empowered. We base our customized plans on the triangle of health, which includes 3 key components: the physical, the mental, emotional, and the biochemical components. Often with difficult issues, there is more than one side of the triangle that has become dysfunctional. Because of this, some people don't get better as fast as others, or they don't get better at all, despite having quality care from a practitioner who focuses on one side of the triangle. At Equilibrium Natural Health, we will work tirelessly to look at you as a whole person so we can address all sides of your health to help you reach optimal health and wellness. Allow me to elaborate on the 3 legs of the triangle. The physical component comes into play in the event of an accident or structural trauma to your body. In this case, you would need to be supported by spinal manipulation, which we provide in the office, massage therapy or physical therapy or acupuncture, of which we have phenomenal community health partners to refer you to. The mental emotional component may stem from emotional duress of an accident, maybe a car accident, maybe a current emotional trauma, or maybe some other past emotional trauma or event. We specialize in several mental and stress therapies to bring you back to a functional state of mental health. Clinically, we have found that coupling the therapies we do in our office with additional talk or other psychotherapy is most effective. Thus, we have built solid mental health partnerships if you need a referral. The biochemical component includes the environment you live in and your exposure to heavy metals, chemicals, or other environmental factors. The foods you eat, the way you digest, or if you don't digest well, your body's elimination function, very important, your brain chemistry, your immune system, and how your hormones function, and how all of those things work together. Treatment plans based on this holistic, whole-body approach look considerably different than traditional medicine. Most people are used to the acute remedies offered through the traditional medical model, which is drugs and surgery. And while they do provide results to spare you, maybe from death or from an extreme painful situation, they don't necessarily provide long-term repair and healing at the end of the day. The time required through the whole body natural approach may be a new concept to some people, but it does provide the best results. In the case of acute situations, oftentimes we will have natural remedies which will also reduce symptoms or provide relief, which may also help in conjunction with traditional therapies, or sometimes we use them in place of traditional therapies. However, it's important to remember that just because the symptoms are reduced, it doesn't mean that you're healed or that your problems have repaired themselves completely. It's simply a reduction in symptoms. Typically, it takes about 1 to 3 months of staying consistent on your supplements and on your nutrition plan to resolve most major symptoms, and sometimes up to 6 or even 9 months with regular visits for more resistant symptoms. Once the symptoms are relieved and the body is in a place of healing, then all the energy can go to fixing the symptoms that have come offline. Once a person has received the level of healing that is desired, you are transitioned into a wellness program that consists of in-person visits once a month or 2 to 4 times a year for those who want the different layers of deeper mental emotional healing. Regular maintenance of health and wellness will help avoid illness and the need for medication and surgery in the future. Note, this concept is not covered by insurance. This topic will be covered further in another video. Now on to the metabolic test that you did in the office, or as we commonly refer to it as the urine and saliva test. It's a very important piece of the puzzle that we use to gain information about what's going on with you. The metabolic test is important as it helps us see details about your physiology, so we can give you accurate advice based on real-time factors. The test covers things like pH, electrolyte status, inflammation levels, digestive capacity, liver gallbladder function, lymphatic function, and if there are imbalances in any of these systems. The information of the metabolic test is sensitive, and it provides us with something more of a recent picture, and it's a little bit different than traditional blood work. We may still need to run traditional blood work, but we also look at blood work a little different than traditional medicine, as we're not just waiting around for you to be sick. We look at blood work from a functional standpoint, using optimal ranges so we can keep you well. We live in a toxic world nowadays, and it is important to understand that to be healthy requires an investment of time and resources to stay well and to stay off medications. At this time, I'm going to ask you some hard questions and to take an evaluation of what is important in your life. What are you spending your time and resources on? When was the last time you spent money on your car to make sure that it was staying up and running, putting in a nice stereo, making it fancy? How about your teeth and your outer appearance? How much time and energy are you spending on your health? Do you make yourself a priority and look at your health as an investment in your future life freedom and enjoyment? To invest in your health increases your chances of having health freedom as you age. The questions we are asking may be a little overwhelming at this point, but they are valid and important for all of us involved to know where you are at. We strive diligently to increase our ability to communicate with you and meet you where you are at so you can continue forward in your health. If you are new to natural medicine, we ask that you sit back and take in what you can, recognizing that it's very easy to be overwhelmed. So we want to encourage you to do things like taking baby steps. So it's one step at a time. We also want you to look at yourself like an infant learning to walk and realize how often infants fall down, but that they keep getting back up until they're able to walk and even run. We want to reiterate that our goal of today's visit is an information gathering session so that we can know what course of action to take for you and that there are no wrong answers. It is stressful, but remember, we are here to help. I want to explain a few things for you in more detail. I know that natural medicine can be overwhelming for most people because there is so much education involved and everyone has an opinion on what is right for you. The reality is that everyone is different, and if anyone tells you there is a one-size-fits-all for all people, either they don't understand diversity in biochemistry or they're just trying to sell you something. We're going to start by helping you understand the basic fundamental needs that are required for us to live healthy lives. The first thing that we need is healthy food. There's a lot of information that is scattered about what food is the best for you and what fad diet may be playing out right now. But the reality is there's no one diet for everyone. In our office, we follow the philosophy that there are three main types of metabolism, or way in which the body takes in energy, and they're grouped in thirds. 1/3 of the population needs lots of green vegetables and should have minimal meat and or animal proteins. 1/3 of the population needs a balance of meat and veggies, and the last third of the population, which have the fastest metabolisms, need to eat red meat or meat in general at about every meal. At Equilibrium Natural Health, our starting point with everyone is diet, as it is your poison or your best healthy energy source 3 times daily. Last but not least, I'd like to quickly go over a couple of frequently asked questions. Insurance does not cover supplements that we have on the shelf here in our office. They're a cost that is required at time of service. Next, if you have a quick question, you can email me directly through your patient portal by clicking on the Messages tabs. Please allow up to 48 business hours for my response. I may be in with patients. I do require a urine and saliva test every 3 to 4 weeks to recheck your chemistry, as it is extremely helpful, objective information for your treatment. This is also something that is not covered by the insurance companies. The cost of the new patient metabolic test is $80, but it's only $25 for a mini test when you return. Every 3 months, I will do another full metabolic test, which is $40 at the time of this recording. Many insurances do a similar urine test, but it does not show the same information, and I do not interpret the information the same. Remember, this is a change in the way you are living, and we expect you to do your best. But that also means that we will meet you where you are at. If you want to go all in, or take pieces that you like and incorporate them one piece at a time, everyone is different and on their own path. We want to support you in your journey in reaching optimal health. If you would like to have access to this video for future reference, please inform the front desk. Thank you for watching, and we'll see you in the next room.